Hi, I'm Tiffany Kimbrough. I'm a general pediatrician here at Chore, and I'm also a mom of two littles. I am 10 days out now from my initial coronavirus vaccine. I got the Pfizer dose. And my initial symptoms when I got the vaccine were none that day. The next day I had a mild headache and mild soreness in my arm and was just slightly run down, a little bit fatigued. And that lasted into the next day. And then after that, I really didn't have anything else to note. I would definitely say my symptoms were on the mild side and not something that I would have considered different than, working a long work week or, just being a little bit under the weather. I chose to get the vaccine because I really believe strongly in the science and the safety of the vaccine, and I also know just how important it is to protect my family and my patients and to be here to provide care. Today I want to just chat a little bit more about the vaccine and hopefully answer a couple of questions that have come up when I'm talking with patients and families around safety and how effective it is, and then focus really on what we know right now about the vaccines in children. The most common question I am receiving is the COVID vaccine safe? And right now we have two vaccines. We're lucky to have two on the market already, from Pfizer and from Moderna. And the short answer is that both vaccines are very safe. The long answer is that both are very safe, but there's still some things that we're learning. So right now, we haven't tested either of them in some populations, like children. And then there's some longer term questions that we're answering, like how long they're effective for, and how often we may need to get boosters, those kinds of things. But we know a lot already about just how safe these vaccines are. A common question or concern families will present me with is, wasn't this vaccine rushed? It's the quickest vaccine that we've ever been able to produce. And that is definitely true, that this is the quickest timeline we've ever had. And I think of that really as just a miracle in terms of the scientists that were able to collaborate. The next quickest vaccine that I'm aware of is the mumps vaccine. It took 4 years from start to finish to get that vaccine out on the market. And we use that regularly today at your kiddos' visits. It's usually paired with measles. And one of the big things I want families to know is that the technology used for these two vaccines, both the Moderna and the Pfizer, use something called mRNA. And that, maybe you read a little bit about it, but that's not new technology. It's actually been around for a while. Scientists started looking into mRNA with the SARS outbreak back in 2003. So when coronavirus, first reared its head for us back in December last year, we were able to take some of that technology that we already knew about to work on this vaccine. We also have put more money into developing this vaccine than ever before. That funding has really allowed scientists to collaborate globally across countries and different hospitals. The amount of teamwork that's gone into this has been unprecedented. And because of how much this pandemic has changed all of our lives, we actually had volunteers sign up for trials in ways that we never did before. So what used to take months and years to get folks to enroll in vaccine studies, we were able to do really fast because everyone was really motivated to figure out how we can get on top of this. And because coronavirus is a pandemic, the rate of disease was so much higher that we were able to get the vaccine studies finished more quickly to see, was there really a big difference in who got disease and who didn't between the folks that got the vaccine and those that didn't, or the placebo or the control group. So all of that together, all those factors really led to that quick timeline, but we know the science and we know the safety and we know the short-term efficacy of these vaccines to be able to say, yes, they're safe and yes, they're important, that we do now. The Moderna product only studied folks down to age 18, so no children were included. The Pfizer vaccine did include 16 and 17-year-olds, so some of our adolescents will be able to get that vaccine once it's available for the general public. Right now, the CDC, the Center for Disease Control, has released a priority list for who should get the vaccines first, and that includes long-term care residents like in nursing homes and healthcare providers and frontline workers. So it'll be a little while before the general public is on that list, but our adolescent patients will be able to get the Pfizer vaccine once it's available. Right now, Pfizer is also enrolling children down to age 12 for study. So they are not in the general population, but we're looking at safety data for children down to age 12. But it'll be a little bit before we have all that information available. So more to come. I hope that we have something we can offer our younger patients in the next year or so, but right now we don't have anything that we can give to kids. And the good news with mRNA is that we're not actually injecting the virus at all. It's not even killed like some of our other vaccines. So the mRNA is completely denatured. There's no way that you can get coronavirus from the vaccine itself. But it's important to know that it does take a few weeks to become effective. So we have had a few folks that have gotten the vaccine and unfortunately not had time to build up their immune response and have contracted coronavirus in that window. They got exposed at some point near their vaccine delivery. But it's important that the vaccine cannot cause coronavirus. The most common symptoms after the vaccine are arm pain. So feeling pain around where your injection site was. 90% of people feel that. A lot of people also will get a mild headache like I had, so 50 to 60% in both the Moderna and the Pfizer trials. Muscle aches and fatigue are the next most common symptoms. Most of these symptoms last folks for anywhere from 24 to 72 hours, and then you're back to your normal self. When folks ask me about serious reactions, usually they're talking about the allergy or having an allergic or anaphylactic reaction. And unfortunately, with any medicine, that is possible. The rate of a severe allergic reaction for these vaccines is 0.002%. So it's super low. There have been 6 case reports to date that I'm aware of for the Pfizer study. And so we do ask folks when they're getting their vaccine if they have a history of severe allergy, especially to any of the ingredients in the vaccines. But unlike a lot of other vaccines, the ingredient list is really short with both of these. So some of the things that people worry about when I talk to my vaccine hesitant patients are additives. And there really are not many in either of these vaccines. So it's important to look at that ingredient list and make sure you aren't allergic to any of the items, but the chance of having a reaction is very low. A common thing that we are talking about with families is how long to expect that they're protected. And right now we don't know the answer to that. Both of the studies, the Moderna and the Pfizer, looked at 2 to 3 months of data prior to applying for emergency use authorization. So we don't know long-term efficacy. We don't know if this is going to last a year, 10 years, but we are hoping, because this is using mRNA technology, that we'll have long-lasting immunity. So more to come on that. We'll find out if we need to get boosters, and if so, when. But the good news is that we know this really severely decreases the rate of disease in the immediate time frame after the vaccine is given. So another question I've heard folks say is, what happens after I get my vaccine? Can I take off my mask? And the important thing to remember is that we know it's going to take a little bit of time, not only for us to develop our immune response, but for enough of us to have gotten the vaccine to be able to relax some of our social distancing measures. The quote that we're tossing around is that 70 to 80% of us need to get vaccinated in order to have herd immunity, or enough of us with immunity in the community to really stop coronavirus from spreading. So it's going to take a little bit of time for that number of folks to get vaccinated. It's really important that you keep wearing your mask, washing your hands, and practicing physical distancing or social distancing in the community. We also don't know the answer to how much these vaccines reduce the chance that we can spread coronavirus to other people. We know that they're really effective at decreasing the rate of disease in the folks who got the vaccines. So while we want to protect ourselves, we also want to protect the community that we live in, and so continuing to mask is going to help to make sure that we keep our neighbors and our community safe. I also just want to put a plug in for those of us that are experiencing illness during this time, that CHOR has a great virtual urgent care that's available. And for more information on that, you can visit the website to see what hours there are and how you can access that great resource amongst our team members. Thank you so much, and if you have any questions, please drop them in the comments.